Hi there, and thanks for joining us. My name is Kathy Phelps, and I'm the Vice President of Customer Experience here at Q-Centrix. This is our second installment in our expert series on COVID, and today we're talking about managing a team through crisis. With me, I'll have Doug McGill. He's our lead consultant for Advisory Solutions. A little bit about Doug's background. Doug comes to us from University of Pittsburgh Medical Center. He had more than a decade of experience while there managing their clinical outcomes and professional practice evaluation. And he lended system-level leadership in the organization's clinical data strategy, as well as launching their mortality support program for frontline care team members. Without further ado, I want to introduce Doug and have him tell us a little bit about himself.
All right. Well, thanks, Kathy, for that introduction. It's great to be able to be here today and talk to you guys about how to manage through crisis. This is my first pandemic that I'm living through, so hopefully my prior experiences lend themselves well to this. I think they do. As you said, I was with the University of Pittsburgh Medical Center for a number of years, and while there, I had the opportunity to grow a number of different teams, both through normal times and also through a lot of transition. And also, unfortunately, at certain points had certain crises that we had to get through. And so my hope today is that I can lend some of that frontline experience to help us think through what we're facing today with the COVID-19 pandemic. I think a lot of the management, techniques and guidance that have been given are great. And I just want to share some of my own thoughts and insights as we move forward, particularly around my work with the mortality support and debriefing program that I launched at UPMC.
Great. Well, I'm really happy to have you here, Doug. So first and foremost, what is the first thing someone should do when they're managing a team through crisis?
Yeah, first and foremost, support your team. It is so important that you recognize that they are your greatest strength in overcoming any crisis or any adversity. When trauma occurs, and I think, if we think about the COVID-19 situation, of our hospital beds being quickly filled up with COVID patients, mounting death tolls. These are all events that can create a lot of stress on our frontline care members. And those teams really need an increase in support during this time. And so one of the most important things that you can do as a leader is take responsibility for assessing the behavioral health of your teams and your departments. Rounding is critical during these times to get on the floor, check in with folks. It's also really important to provide a safe space for folks to decompress, debrief, talk through their emotions, their feelings, and make sure that folks know that they are part of something bigger than just the situation that they're dealing with. That sense of inclusion and being part of a team that's in this together will really help improve morale and keep people from feeling burned out.
Yeah, and speaking of burnout, so these people are going through a lot of pressure, they have a lot of stress, and so that can obviously lead to increased errors. What kind of advice would you have for folks trying to manage a team so that they don't have those errors?
Yeah, this is an important one. And oftentimes what we see is that there's two different types of errors that can be occurring. There can be individual errors, where somebody just puts something in wrong or forgets to do something. And then there's also system errors, where the whole structure was designed poorly for the scenario that it's being played out in. Recognizing those two differences is really key. When you're in a crisis mode as a leader, again, take an inventory of what's being dropped. what processes are kind of falling by the wayside. And the thing of it is that when this ends, you're going to have to resurrect some of those processes. And some of them are totally worth it, and others you may want to just let them lay there on the cutting room floor because they didn't serve you well. And so, this is a real opportunity to say, all right, what's working and what isn't, in a scenario that most of our procedures and operating practices weren't designed to handle. And so it's a really great opportunity to make changes from a system perspective. Now, from an individual error scenario, the more that you can get in front of staff and do some in-person coaching, some observational analysis to really make sure that you're seeing what's happening is crucial. So, every hospital has their annual mandatories and their training programs, but in a crisis situation, you need to up that a little bit, and you need to do some remedial training just to make sure that folks are doing what they need to do. Additionally, you want to ensure that your staff feel supported in that. It can be really nerve-wracking to be in a new situation, and a little bit of remedial coaching can go a long way to encourage staff that, okay, now I know what I'm supposed to do, and I can do this. And so that's another way of helping reduce the stress that oftentimes then causes errors.
Yeah, that makes a lot of sense. One of the words you used was opportunity a couple of times there. And so how can folks take a crisis situation and turn it into an opportunity?
Yeah, adversity is usually not welcomed. But what I oftentimes find is that the status quo in an organization feels much more safe than making any changes. And so you really fight an uphill battle during normal times to make changes. But in a crisis mode, everything is already changing. So some of those safety nets or some of those comforts are now gone, that you have no choice but to adapt and to change. And that can be a really great opportunity to take a fresh perspective, take a new look at how things are being done and say, okay, what do I need? What do I need to do to solve this problem? And that change mindset is powerful, because when you change how you're responding from a defensiveness of like, I don't want to change, to a response of, okay, I have to change and I'm going to, you've already kind of crossed the first hurdle. And so building on that momentum, you want to make sure that you're using this opportunity to build greater collaboration. As I said earlier, your team is your greatest support in this, and you want to go together through any change. So, being able to pull in your team to think critically about new tasks, new functions, new processes, how do we streamline to solve problems and reach goals, is really important. It also builds camaraderie in this process, which is super important.
That's great. So how about your partners? So we're partners to many of the hospitals throughout the country, and obviously we're trying to be the best partners we can be, but what recommendations would you have in terms of other partnerships and our partnership, how people can really take advantage of outside organizations?
Yeah, I think first and foremost, listening is absolutely key. There is so much going on in a crisis that your tasks usually are kind of laser focused on what you needed to get through. And so, listening and understanding wins that opportunity to partner together is really critical. You don't ever want to be another distraction in those processes. And so, but I think also keeping lines of communication open to say, this is what I'm struggling with. Oftentimes you have your normal go-tos to help solve problems, But in a crisis situation, it's so important to continue to communicate what you're seeing, what you're experiencing. And you can almost, like, you can't under-communicate in a crisis for the most part. So it's really important that you keep voicing what you're seeing and what your challenges are, because it gives folks insight, a window into what you're facing, and it allows more people to think critically about the problems and then to come alongside to offer suggestions or tools or improvements, or just to share what their experience has been and what they're seeing working at their site or other sites around the country.
That's great advice. So just rounding it all up, Doug, what would be your final recommendations if folks were just looking for a few tactics that would really take them through their crisis management?
Yeah, so first and foremost, your team is your greatest asset. Make sure that you're supporting them, rounding, checking in, creating safe spaces for them. You know, a good infrastructure is good support. So, you know, the more that you can streamline processes and workloads to create value for your team, the more you're going to get out of them, and the less you're going to be able to decrease those instances of burnout and stress that really work against you in these scenarios. I think the second thing that I would say is, again, get into that change mindset. Things are changing. Accept it and jump in. You know, be willing to think critically and creatively about what's working and what isn't. What are you seeing being dropped? What are you seeing still working well? And really take an inventory of those things so that you can get a strategy and game plan for next steps. You know, as part of that change mindset, one thing that we don't often talk about is opportunities that are created by delays or setbacks. And oftentimes we think that that's just dead space that's happening on something. But these can be great opportunities to actually make some changes in your infrastructure, particularly with like IT platforms and others, to say, okay, those projects that we've been putting off for years, those inefficiencies that we were just living with, now that we have some downtime, now might be a great time to actually tackle some of those projects, especially if we think in the registry world where many of the societies are putting a pause on reporting or removing penalties. So this is a great opportunity to say, hey, I won't fall behind if I actually take some time off now to fix that IT situation that I've been wanting to take care of for, you know, months or years now. And with that too, I think another important thing to think about is how the COVID-19 pandemic is reshaping the virtual workspace. As we're seeing from you know, our partnerships and even within facilities, what new opportunities are created from a virtual workspace are really powerful. And I think as we move through this and out of this pandemic, we will continue to see the value of those virtual teams being able to provide support and solve problems kind of outside the traditional four walls of a hospital or a particular unit or department. So I think, you know, that's another key area to think about. And lastly, I would just say that in reporting data, when you're in a crisis situation, you want to make sure that your cadence of reporting actually is increased so that you can stay on top of any changes that are occurring. So if you normally are getting reports on a monthly or a quarterly basis, you may need to move those up to weekly or even daily reports so that you can respond fast to any changes that you're seeing. You can do a deep dive because your environment has completely changed. So the assumptions that you were dealing with during a normal time or reporting at a month or a quarterly had some consistency in a crisis, all bets are off. You want that data quickly so that you can make really changes on the fly in those situations. And so, yeah, improving or increasing the report cadence is critical. So I think those are probably some points that I would say keep in mind. There's lots of others, but those are the ones that are kind of top of mind for me right now.
Yeah, that's great. Well, I really appreciate the time today, Doug. I really appreciate your insights. I look forward to learning a little bit more as we progress through this series. And thanks everybody for joining us. Please be sure to check in on our next segment on working remotely within this series for COVID. Thanks again.